millions of people around the world take thyroid medicine every single morning. For many, it becomes a fixed part of life. Wake up, take a small tablet, wait for some time, and then continue with the day. It looks simple from the outside, almost routine. But in 2026, a new question is starting to appear more often in medical discussions, patient forums, and health content online. Is thyroid treatment really as simple as it seems, or is something changing in how this medication works for different people? In particular, a newer form of thyroid hormone replacement, called liquid levothyroxine, is getting attention, and many patients are now asking whether it is better than the traditional tablet form that has been used for decades. If you have hypothyroidism, or you take thyroid medication daily, this topic matters more than it might appear at first. Because thyroid treatment is not only about taking a pill every morning, it is also about what happens after that pill enters your body, and sometimes that is where things become more complicated than expected. Most people diagnosed with low thyroid function are prescribed levothyroxine tablets, which have been the standard treatment for many years. These tablets are widely used, well-studied, and effective for a large number of patients. For many people, they successfully restore thyroid hormone levels and help improve symptoms such as fatigue, weight gain, and slow metabolism. However, despite how effective they are, thyroid treatment still comes with one major challenge that both patients and doctors often deal with: absorption. Absorption simply means how well your body can take in the medicine after you swallow it. And this is where thyroid treatment becomes more complicated than it seems. Because even though a patient may be taking their medication correctly every single day, the body may not always absorb it in the same consistent way. The tablet has to go through the digestive system, break down, dissolve, and then enter the bloodstream properly before it can start working. And during this process, many different factors can interfere. Something as simple as drinking coffee too soon after taking thyroid medicine can reduce absorption in some cases. Calcium supplements, iron tablets, and certain vitamins can also interfere if taken too close to the medication. Even some foods, especially those high in fiber or certain minerals, may affect how the body processes the drug. On top of that, certain medical conditions such as digestive disorders, acid reflux, or intestinal absorption issues can make things even more unpredictable. This is why doctors often give very specific instructions, such as taking levothyroxine on an empty stomach and waiting before eating breakfast or drinking coffee. But even when patients follow all these instructions carefully, some still experience fluctuations in their thyroid levels. One blood test may look fine, while the next shows unexpected changes. Symptoms may improve for a while and then slowly return again. Energy levels may go up and down. Doctors may adjust the dose multiple times. And eventually, many patients start to wonder why their thyroid levels are not staying stable despite doing everything right. This is where newer treatment discussions begin to become more relevant. In recent years, a newer formulation called liquid levothyroxine has started to gain attention. At first, it may not seem like a major medical change because the active ingredient is still the same. It is still levothyroxine, the same thyroid hormone replacement used in standard tablets. However, the difference lies in the form. Instead of a solid tablet that needs to dissolve inside the digestive system, liquid levothyroxine is already in liquid form when it enters the body. This difference may sound small, but in medicine, small changes in formulation can sometimes lead to differences in absorption. Because when a medication does not need to dissolve first, it may in some cases enter the bloodstream more consistently. This is why liquid thyroid medicine has started to attract attention from certain doctors and patients, especially those who struggle with unstable thyroid levels despite regular treatment. The idea behind liquid levothyroxine is fairly simple. If the body can absorb the medication more efficiently or more consistently, then thyroid hormone levels may become more stable for some patients. This is particularly interesting for individuals who have conditions that affect digestion or absorption. For example, patients with gastrointestinal disorders may not always absorb tablets in the same way as others. Similarly, People who take acid-reducing medications for stomach issues may also experience changes in how certain medicines behave in the body. In such cases, the formulation of the medication could potentially play a role in how effective the treatment feels. However, this leads to one of the most important questions people are asking in 2026. Is liquid thyroid medicine actually better than levothyroxine tablets? The honest answer is not as simple as yes or no. For many patients, standard levothyroxine tablets continue to work extremely well. In fact, they remain the first-line treatment for hypothyroidism and are still prescribed to millions of people worldwide. Many patients achieve stable thyroid levels and good symptom control using tablets alone, without any need for changes. For these individuals, there is no clear reason to switch to a different formulation. At the same time, research and clinical experience suggest that certain groups of patients may benefit from alternative formulations. These are not general recommendations for everyone, but rather specific situations where absorption issues or inconsistent thyroid levels continue despite proper tablet use. Patients with digestive problems, those taking medications that reduce stomach acid, or those who experience unstable hormone levels even after correct dosing may sometimes be considered for different options, such as liquid levothyroxine. So, instead of thinking about this as one treatment being better than the other, it is more accurate to understand it as different tools for different situations. Medicine does not always follow a one-size-fits-all approach. Two people with the same condition may respond very differently to the same medication. One person may remain stable for years on a standard tablet, while another may struggle with fluctuations despite following all instructions carefully. This does not necessarily mean the medicine is ineffective, but rather that individual differences in the body can influence treatment outcomes. Because of this, thyroid treatment is often becoming more personalized. Doctors may consider not just the diagnosis, but also lifestyle, digestion, other medications, and how consistently thyroid levels are responding over time. In some cases, adjusting the timing of the tablet may be enough. In other cases, a different formulation may be explored. And in selected patients, liquid levothyroxine may offer an alternative option worth considering. It is also important to understand that changing thyroid medication is not something that should be done casually. Switching between different brands or formulations, or adjusting doses without medical supervision, can affect thyroid hormone levels significantly. And since thyroid hormones influence many systems in the body, including energy, heart rate, metabolism, mood, and sleep, even small changes can sometimes lead to noticeable effects. This is why medical guidance is essential when any changes are being considered. So when we look at thyroid treatment in 2026, it is not necessarily about a brand new replacement for existing medication. Instead, it is more about expanding options and understanding that absorption and formulation may matter more for some patients than previously thought. Traditional levothyroxine tablets remain the foundation of treatment and continue to be highly effective for most people. At the same time, liquid levothyroxine is emerging as an additional option that may help selected patients who struggle with consistency. In the end, thyroid treatment is not just about taking a pill every morning. It is about finding the right balance between dose, timing, and in some cases, formulation. And as medical understanding continues to evolve, the focus is shifting more toward individualized treatment rather than a single universal solution. For some patients, that may mean no change at all. For others, even a small adjustment in formulation could make a meaningful difference. So the real question is not just whether liquid thyroid medicine is better. The real question is, which form of treatment works best for you?